Hi, this is Dr. Bhargava. I have an interesting case to share with you all. This is a 63-year-old woman who presented with abdominal pain. We performed a CT of the abdomen and pelvis. We're starting at the level of the liver because the findings are more inferiorly. And as we go down from the abdomen into the pelvis, focus on the ascending colon. And here is the terminal ileum, and right next to it we see this inflamed appendix. So this tubular structure which ends right here. It's distended, contains appendicolith 1, 2, and 3. And so this patient was diagnosed with acute appendicitis. Let me also quickly show you the coronal images. As we are scrolling from anterior to posterior, this is the cecum, this is the terminal ileum, and here's the appendix and the hyperdense appendicolith inside. And as we follow it, it's distended, inflamed, and here's appendicolith number 2 and 3, and that's where the appendix ends. So this patient underwent a laparoscopic appendectomy, and 3 weeks after the procedure they presented again with abdominal pain and fever. And here is the CT from that time, and again we are following from superior to inferior. We find that the appendix is absent, but in the pelvis, these are post-appendectomy changes right here. Clips in the pelvis, we see this collection right here which has a thick wall with rim enhancement, and at the periphery we see this hyperdensity 2 and 3, and these are appendicoliths which were dropped at the time of laparoscopic appendectomy, and now they're sitting in the dependent portion of the pelvis and they have created this abscess. So this patient was treated with antibiotics and they came back 2 weeks later, and we documented that the abscess had resolved and the appendicoliths that were dropped from appendectomy are still present in the dependent portion of the pelvis. So this space right here between the uterus and the rectum, the recto-uterine pouch of Douglas, it is the most dependent portion in the pelvis, and whenever something drops inside the intraperitoneal compartment, it will come to this location and stay there sometimes forever, such as appendectomy clips, dropped gallstones, or dropped appendicoliths like in this patient. Thank you for watching.